So moving to the next issue, we'll be looking at cardiomyopathies in children. Cardiomyopathies in children. All right. So defining terminologies: when you say cardio is heart, myo is muscle, so muscles of the heart. Pathies, of course, is disease conditions of the muscles of the heart. Okay. So some people might have actually ignored this and said that cardiomyopathies could be seen only in the elderly. No, it can be seen in children too. Okay, so let's look at examples, and let's look at what things that actually predispose these children to actually having these diseases of the heart muscles. So this could be a cardiomyopathy where the left ventricle is kind of like getting larger than. Of course, cardiomyopathies will have an effect on what the amount of blood coming into the heart and the amount of blood going out of the heart. Okay, so it will affect the whole system. Yes, the left side deals with what? Oxygenated blood. If oxygenated blood is not reaching everywhere adequately, they have an issue, right? So cardiomyopathies, they are just a group of rare but serious heart muscle disorder. So the issue is from the heart muscle. The heart muscle is getting too thick or is getting too soft, getting too large. You understand? So so the heart muscles, these issues are affecting it. Is they are not being able to pump blood effectively. So these conditions are often genetic or acquired. All right. So they give back to you with it, or just within the childhood, some things happened. Okay. So what are the pediatric cardiomyopathies? I'll say so. Disease of the heart muscles, that's myocardium in children. Okay, can be inherited due to genetics. That means they gave back to you with it. Secondary, you got it along the line, all right, due to infections, metabolic disorders, systemic diseases. You understand? So types of this cardiomyopathy, just like we saw, this one is dilated. The heart muscle is becoming thinner. That's the left ventricle becoming thinner, becoming too large. That's dilated. You can have hypertrophic. Okay, so thickened heart muscle, hypertrophic. All right, I did well to bring a lot of pictures for you guys. Restrictive cardiomyopathy. This one, the heart muscle is same, but it's not relaxing again. It's stiff. All right. Then left ventricular non-compaction. Then arrhythmogenic cardiomyopathy. All of them, we'll get to look at them in subsequent classes. Okay. Let me just snap them so that I'll remember. Then, alright, so causes and risk factors. Genetics, that one they gave back to you with it. Alright, it's not your fault. Due to viral infection within that time of childhood, metabolic or mitochondrial disorders, neuromuscular diseases, okay, chemotherapy or radiation exposure, autoimmune conditions where the immune system of the body is still fighting the body's own cells. Okay, then idiopathic, where the cause is not known in many cases. So symptoms in children is what? They are weak, there's a poor feeding, shortness of breath, chest pains, palpitations or fainting, swellings in the leg or abdomen, poor growth or weight gain, sudden cardiac arrest. Okay, this one is also dilated. The dilated is very much more common. Do you understand? So diagnosis is I'm doing echocardiography just to access how the heart is still functioning. Electrocardiography, trying to dictate all those electrical activities. Cardiac MRI, genetic testing, blood tests. Okay, so treatments just depend on the type and severity. Can use medications like diuretics, beta blockers, angiotensin converting enzyme inhibitors. Then also drugs that are helping to control how the heart is not beating well again, right? The lifestyle modification, implantation devices, heart transplant, okay, and all of that. Okay, so that's just it for this. Bye for now.